This is the diagram of outer surface of hip bone. Now we will discuss the attachments of the three parts of hip bone on its outer aspect. You can see the superior part, fascial part, which is ilium. On ilium, we'll start from anterior superior iliac spine. Anterior superior iliac spine gives attachment to inguinal ligament, as mentioned here in green color, and then it also gives origin to sartorius muscle, which is a muscle of thigh. Then we'll see on the outer lip of iliac crest, there is a muscle attached, tensor fasciae lata. Other than that, on the iliac crest, muscles of abdominal wall are attached, and their name cannot be mentioned in this diagram as they are not involved in the lower limb anatomy. Now, looking at the anterior border of ilium, we can see that there is an attachment of straight head of rectus femoris on the anterior inferior iliac spine. Just behind that straight head, just above the acetabulum, there is origin of reflected head of the same muscle, rectus femoris muscle. Then looking at the posterior border of the ilium, we can see the attachment of sacrotuberous ligament just above the posterior inferior iliac spine, and we can see on the gluteal surface there are three muscles attached. The posterior most muscle, which is from behind the posterior gluteal line, is the gluteus maximus. Then between the middle and posterior gluteal line, we can see, or the anterior and posterior gluteal line, we can see the gluteus medius, and between the inferior and anterior gluteal line, we can see gluteus minimus muscle. So gluteus minimus is in the front and the smallest muscle of the gluteal region, while gluteus maximus is the outermost muscle and the largest muscle of the gluteal region. Now we can see the acetabulum. On the margin of acetabulum, first the acetabular labrum is attached, and outside the labrum is the attachment of capsule. Now looking at the pubis, we can see that on the superior ramus of pubis, the superior surface is giving attachment to pectineus muscle. The area is also called pectineal line and pectineal surface. On the pubic tubercle, there is attachment of inguinal ligament, shown in green color. Now from the body of pubis and inferior ramus, there is an attachment of muscles of medial compartment of thigh, which are adductor longus muscle, adductor brevis muscle, adductor Magnus muscle, and Gracilis. You can also see that part of the adductor Magnus is extending up to the ischial tuberosity. So adductor Magnus is partly in the medial compartment and partly in the posterior compartment of thigh. And the muscles of posterior compartment of thigh are going to arise from the ischial tuberosity and the region around it. They are also called hamstrings, and they are shown in the diagram on the ischial tuberosity: semimembranosus, semitendinosus, biceps femoris, and part of adductor magnus as shown here. And then we can also see on the femoral surface there is origin of quadratus femoris muscle. Now small muscles are also taking origin below the ischial spine. You can see two muscles, gemellus superior and gemellus inferior, from the greater sciatic knot. And then on the ischial tuberosity, there is attachment of a sacrospinous ligament. The sacrotuberous and sacrospinous ligaments are two important ligaments which are going to convert the greater sciatic knot and lesser sciatic knot into foramina. And around the obturator membrane, you can see the attachment of obturator externus muscle. The obturator externus is going to arise from the combined ischiopubic ramus and also from the obturator membrane. Mostly the lower limb muscles are arising from the outer aspect of hip bone. The inner aspect of ilium gives attachment to an important muscle, which is iliacus muscle, which is going to be inserted on femur, and then we can see on the superior surface of the pubic ramus there is pectineus muscle. Other than that, you can also see a muscle arising from the inner side of sacrum, piriformis muscle, which is going to be inserted on the femur. Other than that, the other muscles which are taking origin from inner surface are not important in case of lower limb anatomy. Looking at the anterior aspect of femur, we can see that on the greater trochanter, on the inner side or medial surface of the greater trochanter, you can see the attachments of obturator internus muscle, superior inferior gemelli, and along with that, on the highest part or the apex of the greater trochanter, you can see the insertion of piriformis muscle. These muscles are coming from the hip bone and inserting on femur. Then on the anterior aspect of the greater trochanter, its lateral surface, you can see the gluteus minimus muscle, which is the anterior most muscle of the gluteal region, also the smallest muscle inserted here. Now looking at the lesser trochanter, you can see there is insertion of iliopsoas, which is basically a combined tendon of iliacus muscle and a psoas major muscle coming from the lumbar vertebrae. Now, on the anterior surface of the femur, you can see mostly a large muscle taking origin, which is vastus intermedius muscle. Then we can see vastus lateralis just below the greater trochanter taking origin from here, and then the origin is extending posteriorly to the lateral lip of linea aspera. On the medial side, just behind the lesser trochanter, you can see just in front of the lateral trochanter, you can see the origin of vastus medialis muscle, which is going to extend on the spiral line and then the medial lip of linea aspera. Vasti muscles, vastus medialis, vastus lateralis, and vastus intermedius, these three plus the rectus femoris muscle, these four muscles are part of one single muscle called Quadratus Femoris, which is the main muscle of anterior compartment of thigh. Also, you can see a very small muscle articularis genu taking origin from the lower part of anterior surface. On the adductor tubercle, on just above and posterior to the medial epicondyle, you can see the insertion of adductor Magnus muscle. You can see a lot of muscles attached on the posterior aspect of femur. Will start from the upper end. On the inner side, again, in the fossa of greater trochanter on the medial surface, there is attachment of obturator externus, which is posterior to the attachment of obturator internus and gemelli, which you had seen on the anterior aspect. Now you can see the gluteus medius muscle on the posterior part of the lateral surface of greater trochanter. You saw the minimus muscle anteriorly. You can also see the insertion of quadratus femoris muscle on the quadrate tubercle, which we had discussed later, and iliopsoas on the lesser trochanter. Now coming to the posterior surface of the shaft, we'll have to look at the insertions or origins in a arrangement proper. You can see from the medial side, the vastus medialis muscle is extending on the spiral line and the medial lip of linea aspera. Next to that, pectineus muscle is attached on the upper part of the posterior surface. Then we can see that adductor longus and adductor brevis muscle are attached lateral to the vastus medialis origin on the intermediate area of linea aspera. Next to that, a large insertion area is seen on the adductor magnus muscle. Adductor magnus muscle is inserted on the linea aspera here, then there is a gap, and then the other part of adductor magnus is inserted on the adductor tubercle. So there is a gap between the insertions of adductor magnus muscle, which is important because this is the foramen or a hiatus of adductor magnus seen in the insertion. Then next to that you can see origin of biceps femoris muscle, and next to that on the lateral lip of linea aspera we can see the origin of vastus lateralis is extending. So on the upper part of the posterior surface, the lateral lip also was extending up to the gluteal tuberosity, and gluteal tuberosity is giving insertion to the largest muscle of gluteal region, the gluteus maximus muscle. In the lower end of femur, you can see just above the medial and lateral condyles, there are the two heads of an important muscle of leg, which we'll see later. The medial head and lateral head of gastrocnemius muscles are taking origin, and also from the part near the lateral epicondyle, postero-inferior to the lateral epicondyle, we can see a muscle originating called Popliteus muscle. The arrangement of the muscles attaching on the linea aspera is very important. You have to memorize these muscles in proper order. Coming to the clinical anatomy of these two bones, we are going to discuss the fractures and deformities. Although hip bone and femur are very strong bones, they are prone to fracture or deformities in extreme of ages. In small ages like children, we see vitamin D deficiency associated deformities, and in older persons, especially in women, osteoporosis is a reason for these fractures and deformities. In this diagram, you can see there is a deformity, a bending of neck of femur in two extremes, in which one of the diagram, the A diagram, is showing that the bending is such that the angle of inclination is decreased. This condition is called coxa vara. Now, coxa vara results in, first of all, shortening of the height of that person, and abduction of femur is also limited. The opposite condition, in which the angle is more obtused or increased, is called coxa valga, and both these conditions are more prone to fractures when there is trauma or accident. Here you can see a transcervical fracture or the fracture of neck of femur. These fractures are usually also known as hip fractures, because in hip fractures mostly the neck of femur is broken. These are associated mostly with old persons and in osteoporosis, especially in female. And in this condition, the blood supply of the upper end of the femur is disrupted in some cases, except for the region around the fovea, where there is another artery entering the round ligament of head of femur. These fractures are usually associated with initial changes in angle of inclination, and then a small trauma or accident can result in these fractures in old age especially. Spiral fractures of the shaft can also occur, especially in athletes who land with a great force on their legs and during car accidents or other vehicle accidents. In this condition, the fragments may overlap each other, and also that there are important vessels of this region associated with the shaft, and the edges of these fragments can sever those vessels and nerves related. Multiple fractures can be seen during direct trauma when a person is falling from a height and landing directly on that side of the femur, and during vehicle injuries, accidents. And you can see in the x-ray that the lesser trochanter is broken separately, and then there is fracture of along the intertrochanteric line. So communicated fractures are not very common. They are occurring only in severe injuries. Fractures of the lower end of femur are not very common.